This multivitamin-iron-folic acid tablet is used to treat or prevent vitamin deficiency, which can occur due to a poor diet, certain illnesses, or during pregnancy. It contains important vitamins and iron that are essential for the body and help maintain good health. It is important to take this medication as directed by your doctor. Typically, the recommended dosage is once daily, preferably with a meal to help with absorption. It is best to take this medication at the same time each day to help you remember. When taking the multivitamin-iron-folic acid tablet, it is best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow all directions on the product package and not to exceed the recommended dosage. It is best taken on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food. It is important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as they may decrease its effectiveness. After taking the tablets or capsules, it is recommended not to lie down for at least 10 minutes. If you are taking the delayed-release form or extended-release capsules, it's important to swallow them whole and not to crush or chew them. Taking them in a different way can increase the risk of side effects. It is also important not to split extended-release tablets unless instructed by your doctor or pharmacist. It is recommended to take this medication regularly at the same time each day to get the most benefit from it. If you experience constipation, diarrhea, or upset stomach, these effects are usually temporary and may go away as your body adjusts to this medication. If any of these effects persist or worsen, contact your doctor or pharmacist promptly. Iron may cause your stools to turn black, but this effect is not harmful. If your doctor has prescribed this medication, they have determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. For those in the U.S., call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. The accidental ingestion of iron-containing products is a common cause of fatal poisoning in children under 6. It's important to keep this product out of reach of children, and if accidental ingestion does occur, seek medical help or contact a poison control center immediately. Now let's talk about the uses of multivitamin-iron-folic acid tablet. This medication is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. It is also used to improve iron levels in the body and to prevent anemia. The dosage and timing of taking this medication may vary depending on individual needs and medical conditions. It is best to follow the instructions provided by your healthcare professional and the directions on the product label. Generally, it is recommended to take this medication with a full glass of water on an empty stomach or as directed by your doctor. Remember to not take more than the recommended dosage, and if you have any concerns or questions, consult your healthcare provider for more information. It is important to talk to your doctor or pharmacist before taking this multivitamin-iron-folic acid tablet if you are allergic to any of its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. You should also inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, use or abuse alcohol, have liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, be sure to tell your doctor if you have vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency may result in serious nerve problems. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of potential interactions with other medications. This product can affect the absorption of certain drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. Be sure to separate your doses of these medications from your multivitamin-iron-folic acid tablet, and consult your doctor or pharmacist for guidance on creating a dosing schedule that works for all your medications. If your multivitamin also contains folic acid, let your doctor or pharmacist know if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and your doctors that you are taking this medication. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed this medication, it is important to follow their instructions and not share it with others. It is important to keep all medical and lab appointments while taking this medication. Some brands of multivitamin-iron-folic acid tablets may also contain ingredients such as docusate. If you have questions about the ingredients in your brand, it is best to ask your doctor or pharmacist. It is important to remember that this product is not a substitute for a proper diet. It is best to get your vitamins and minerals from healthy foods and maintain a well-balanced diet. It is also important to follow any dietary guidelines as directed by your doctor. The daily dosage of multivitamin-iron-folic acid tablets should be taken as directed by your doctor. It is best to take it with a meal to help with absorption. Taking it at the same time each day can help you remember to take it consistently. If you have been prescribed to take this multivitamin-iron-folic acid tablet on a specific schedule and happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. Remember to follow your doctor's instructions closely for the best results. When it comes to storing your multivitamin-iron-folic acid tablet, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. And when it comes to disposing of the product, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard the tablet when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.